Welcome to today's video on the high premium paradox, where paying more each month for health insurance can actually save you money over the year. First, we will set the stage by explaining why the common approach of adding premiums to out-of-pocket maximums can mislead you. Then, we will compare plan tiers, walk through real numbers, and show when higher tier plans win. Throughout, we will focus on expected usage, not just worst-case scenarios. Now, let's dive into the agenda so you know exactly what's coming up. Here is our roadmap. We start with the paradox and why the typical calculation fails. Next, we will break down deductibles, coinsurance, copays, and out-of-pocket maximums. After that, we will compare plan tiers and map them to real-world personas. Then, we will estimate usage and run a case study. Finally, we will test your understanding with quick quizzes and wrap up with key takeaways and a short disclaimer. Let's begin with the core idea. The paradox is simple. Choosing a plan only by adding monthly premium to the out-of-pocket maximum ignores how costs accumulate during real usage. High-tier plans front-load protection by reducing or eliminating deductibles and increasing the insurer's share immediately. If you expect moderate or heavy use, those features reduce your ongoing costs and help you reach the out-of-pocket maximum faster, often making a higher premium plan financially safer. Next, we will clarify how plan mechanics work. Here are the key moving parts. Premium is the monthly fee to keep your plan active. The deductible is the amount you must pay before the insurer contributes to most services. Coinsurance is your share of costs after the deductible, expressed as a percentage. Copays are fixed fees for certain services or prescriptions, often applying even before a deductible on higher tier plans. Finally, the out-of-pocket maximum is the annual cap on your spending for covered, in-network services. With this foundation in place, we can now highlight the common math trap and why it fails in real life. A common error is to compare plans using only annual premium plus the out-of-pocket maximum, assuming that worst case equals the deciding factor. In reality, few people immediately hit the cap. Instead, you pay as you go, and the structure of cost sharing matters a lot. Bronze looks good on a maximum-only comparison because premiums are low, but the path to care is more expensive due to high deductibles and lower coinsurance. Platinum, however, reduces upfront barriers and covers more of each bill, often saving money for anyone with moderate to high expected usage. Now let's contrast the tiers directly. Bronze plans usually feature lower premiums but require a high deductible before meaningful coverage begins, followed by lower coverage percentages. This leads to higher ongoing payments for each service and a slower, more painful path to the out-of-pocket maximum. Platinum plans cost more monthly but remove or minimize the deductible and increase the coverage percentage, lowering coinsurance. This structure means you pay less per service, receive immediate cost sharing, and reach the annual cap more efficiently if you use care. Next, we will map these differences to common user profiles. This table maps typical personas to plan tiers. Low users who are comfortable with financial risk and fewer services may lean bronze or silver. Those with chronic conditions, frequent visits, testing, or recurring prescriptions generally benefit from gold or platinum due to immediate cost sharing and higher coverage. Families and anyone anticipating a significant procedure often find high-tier plans, reduce per-visit expenses, and limit exposure to large bills. With personas in mind, we will now visualize how coverage percentages differ by tier. This pie chart shows the typical actuarial coverage by tier. Bronze covers roughly 60% of costs once the deductible is met, while platinum covers up to about 90%. Lower deductibles and higher coverage percentages mean that high-tier plans start helping sooner and more substantially. Copays on higher-tier plans often provide predictable costs from the first visit. Remember that all plans have an out-of-pocket maximum, but higher tiers can make the journey to that cap much less financially stressful. Next, let's turn this into a practical process for estimating your own usage. To estimate usage, review the last 1 to 2 years of medical claims, prescriptions, and visits. Identify expected events such as surgeries, pregnancies, or chronic care follow-ups. Sum the number of visits and monthly prescription costs. Then, apply each plan's deductible, coinsurance, and copays to these items to simulate annual spending. Create low, medium, and high scenarios to reflect uncertainty. Factor in your risk tolerance. Would a high deductible be a strain? Finally, Confirm that your providers are in-network and that your medications are covered favorably on the formulary. With this framework in mind, let's test your understanding with a quick quiz. Question: with 8 specialist visits and $300 per month in prescriptions expected, the Platinum plan has a $0 deductible and higher coverage, while the Bronze plan has a $2,000 deductible and lower coverage. Which plan is likely cheaper overall? Options: Bronze, Platinum, they will cost the same. Can't tell without any numbers. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is Platinum. With multiple specialist visits and recurring prescriptions, the immediate cost sharing of a $0 deductible and higher coverage typically reduces total spending compared with a Bronze plan that requires a large deductible and covers a smaller percentage afterward. Now let's reinforce the concept with a second question, focusing on out-of-pocket maximums. Question: if 2 plans have the same out-of-pocket maximum, is choosing the lower premium always the best decision? Options: yes, no, only if you never use care, only if the deductible equals the out-of-pocket maximum. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is no. 2 plans can share the same out-of-pocket maximum, yet differ significantly in deductibles, coinsurance, and copay structures. Those differences determine how much you pay throughout the year before hitting the cap. Next, we will walk through a concrete case study with numbers to make this even clearer. Let's compare Bronze and Platinum with sample numbers. Assume Bronze premiums are $250 per month and Platinum premiums are $450 per month. The scenario includes 12 specialist visits at $200 billed each, totaling $2,400, and prescriptions at $300 per month, totaling $3,600 per year. Under Bronze, you pay the first $2,000 to satisfy the deductible. The remaining $400 of visit charges would then be subject to 40% coinsurance, costing $160. Prescriptions under Bronze may face the deductible or higher tier costs, causing significant early year spending. Premiums total $3,000 annually. Under Platinum, there is no deductible, and coinsurance is approximately 10%, with copays applying immediately. Visits cost about $240 total at 10%, and prescriptions see immediate cost sharing, perhaps around $360 at 10% for this rough comparison. While Platinum premiums add to $5,400 per year, the reduced per-service costs can make total spending competitive or lower for moderate to heavy usage, and importantly, less volatile month to month. These are illustrative figures. Your plan specifics will vary. Now let's visualize the decision process as a quick mind map. This mind map lays out the decision. Starting from the center, low usage flows toward Bronze or Silver due to lower premiums. Moderate usage points to Gold, where lower deductibles and higher coverage improve value. High usage points to Platinum for maximum immediate protection. If prescriptions are a major component of costs or you have chronic care needs, the branches converge on Gold or Platinum for predictable and higher coverage. The budget risk tolerance branch splits. Those with low risk tolerance prefer higher tier plans. Those comfortable with risk may accept lower tiers. Separate branches remind you to verify network participation and drug formularies. With the decision framework in place, we can summarize the key takeaways. The main lessons are: do not select plans solely by adding premium to out-of-pocket maximum. Higher tier plans function like prepaid coverage, reducing costs immediately. Deductibles and coinsurance dictate what you actually pay per service. Moderate to heavy users frequently benefit from Gold or Platinum. Build a usage model including visits, prescriptions, and anticipated events. Finally, confirm your providers and medications are covered in network and on the formulary. Before we wrap, a brief disclaimer. This video is for educational purposes and is not financial, legal, tax, or medical advice. Plan structures, coverage percentages, cost-sharing rules, networks, and formularies vary by state, carrier, and year, and can change. Always review official plan documents and consult your insurer or a licensed professional before making decisions. Now, let's recap and close with next steps. To conclude, focus on your expected usage rather than only the worst-case cap. High-tier plans can reduce ongoing costs, smooth cash flow, and lower risk for frequent users. Build scenarios and compare totals before you enroll. and confirm your providers and medications are covered each year. Finally, let's close with a quick favor. Thank you for watching. If you found this useful, please like the video, share it with someone comparing plans, and subscribe for more clear breakdowns. Tell us in the comments about your experience choosing between bronze, silver, gold, and platinum, and what surprised you about the costs. See you in the next one.